Okay, so as I said here, not exactly healthcare light. Try healthcare light her. My next guest says don't be fooled either way. Not as big, it's still big, and Dan Mitchell from the Cato Institute still doesn't like what he's seeing. So Dan, that's kind of my, nutty prediction on all this. It's going to be big, not as big, but you're arguing still a big problem. Why?
Well, first, your prediction is probably right, unfortunately, because Republicans specialize in snatching defeat from the jaws of victory. And a couple of these Republicans on the Finance Committee want to be legislators. And so they're going to go down and sell out their party, sell out the economy, sell out their country so they can get a deal. And what will this mean in terms of numbers? Even if it's only $750 billion in the first 10 years, it's like being 3 months pregnant. Guess what? A couple of months down the road, you'll be 6 months pregnant, and then 9 months pregnant. Everything we've seen from government, from the creation of Medicare, Medicaid, other government health programs, they start small. The politicians always underestimate the cost. They always add on new benefits and new handouts and further destroy what's left of the private market system. If this goes through, we are going to wind up like the United Kingdom with a creaky, inefficient, expensive healthcare system that rations us and makes it hard for us to get our families good healthcare.
Dan, you raised so many.
But other than that, I like it.
Other than that, there's a link, and how was the show? Now, one of the things, Dan, I found interesting in looking at Medicare in 1965 and the press clippings at the time, there was a lot of disappointment by liberals and those who were supporting Johnson with getting this, that it had been dramatically pared down. I was surprised looking back at this that it was not the program that Johnson envisioned and that folks like Hubert Humphrey were pushing, that it was drastically curtailed. And yet we knew, in retrospect of this program, that ultimately was costing the government $65 million its first year, grew to $400 billion last year, and is now counting out $5 trillion plus in benefits as of this year. So, for those who say, yeah, we calmed the beast is still there, isn't it?
And I think the Medicare situation that you just explained is very much a roadmap for what we're going to see. Some deal will get struck with these quisling Republicans in the Senate delivering a victory for Obama and big government. The liberals in the Democratic Party will say, oh, this is terrible because government's only expanding by $750 billion instead of $1 trillion. But at the end of the day, they'll get their $1 trillion because once you start giving out free stuff from the government, costs are going to explode. We see this with cash for clunkers. The politicians don't know how to manage anything. They don't know how to estimate costs. And so we're going to see an exploding program with higher costs. Taxpayers are going to get it in the neck, and consumers are not going to get good health care.
If you'll follow my wacky black helicopter crowd theory on this, how this healthcare thing's going to get done, because it seems like you share this helicopter with me. This public option, I think the government option is going to fail up front. In other words, it won't be part of what ultimately we do because there's just too much of a buzzsaw criticism running into it. But I do think the administration will revisit. In other words, they get their feet wet, they're in there, they've got more government control without calling it more government control. Then they really go full throttle later. What do you think of that?
Well, it's nothing to do with black helicopters. It's simply the way government operates. We already have the federal government directly providing almost half of our nation's health care through programs like Medicare and Medicaid. What's left in the nominal private sector, of course, is heavily controlled and regulated by government, so there's really no semblance of a free market in health care. Now we're going to expand government subsidies and handouts, ostensibly to get more people in the insurance net, but that's going to exacerbate what we all know of as a third-party payer problem, which is that you don't have a functioning market when you're shopping with other people's money. And those government handouts are going to drive up costs and make everyone think that the private insurance market doesn't work. And so, yes, we are going to sow the seeds for a government option, whether it's explicit in the original bill or we're simply setting the stage for it by destroying what's left of the private sector.
Well, Dan, people on the right or left agree or disagree. A lot of the stuff that you've been saying sometime back, so as long as I've been talking to you, has come to pass. So word to the wise. Listen to what this fellow's saying. Dan Mitchell, Cato, thank you very much.
Thank you, Neil.